Hearing loss is one of the most common global disabilities. 80% of people who have hearing loss live in the developing world, and 28% of these are children. The Global Foundation for Children with Hearing Loss was created to help children in developing countries who are deaf or hard of hearing. We help them access the early identification, hearing technology, and trained professionals they need to learn to listen, talk, and integrate fully into their hearing communities. We believe every child should have the opportunity to reach their full potential in our hearing world. Our Vietnam Deaf Education Program is a holistic initiative spanning education and healthcare. It involves 38 schools and 3 hospitals across 20 Vietnam provinces. The program utilizes the expertise of our team of professionals, our training curriculum, and our experience managing multifaceted programs. We increase awareness and build technical knowledge to support the development of listening and spoken language in children with hearing loss. Our volunteer professionals working internationally in audiology, speech pathology, early intervention, and deaf education make us successful. Many are recognized leaders in their fields. They commit time and expertise throughout the year to help the Global Foundation develop and implement quality programs to support children with hearing loss. We've built a strong relationship with our Vietnam partner, the Thuy Nhan Center for Disabled Children, which has enabled our Vietnam Deaf Education Program to successfully respond to the needs of children with hearing loss and the professionals and families who work with them. The people involved in this effort and the resulting quality of our work are the key elements that make our organization successful. We're one of the few organizations in the world that offers an integrated model of training and support across education and healthcare. We address the essential elements that children with hearing loss need to be successful in their listening and spoken language development. We collaborate with in-country partners and customize our programs to their needs, fostering shared accountability for success. Our training programs focus on the same group of professionals over time so that the participants build on their knowledge. They share their learning with others, making the benefits exponential and sustainable. We monitor our Vietnam Deaf Education Program through quantitative tests, competency exams, and qualitative surveys administered to participants. The results help us assess their progress. We then make necessary adjustments to address weak areas. Further, we collect audiology and case history information about the children who receive our hearing aids. These children are supported by the Vietnamese participants in our program, providing a means to monitor the children's auditory and language progress over time. We're also teaming with speech and hearing academics on ResearchLine to measure the effectiveness of our work and to shed light on the needs and opportunities for children with hearing loss in Vietnam and other developing countries. It's a common misperception that children fit with hearing aids or cochlear implants will immediately be able to speak. But these children also need the support of trained professionals who can help them process sounds that they weren't born hearing and learn to listen and talk. We stress the importance of working across our education and healthcare in all our programs for the most successful outcomes in listening and spoken language for children with hearing loss. We've been working in Vietnam since 2010. Through our Vietnam Deaf Education Program curriculum, we've trained more than 190 teachers, 220 families, and 120 medical and other professionals about audiology, speech pathology, early intervention, and auditory verbal deaf education. We provided more than 250 hearing aids to children in need. The results of our tests have pointed to a measurable increase in proficiency amongst the Vietnamese over time, and we have evidence that the participants are sharing their learning with others in their home communities. Our Vietnam deaf education program is benefiting more than 1,000 children with hearing loss. Hearing loss is one of the world's most common disabilities, but is among the least supported. While progress has been made, there's a general lack of understanding about the implications of hearing loss on children and how it can be addressed. This has made it challenging to attract attention and funding for the issue. Our Vietnam Deaf Education Program is increasing awareness about what's possible for children with hearing loss. It's also empowering families and professionals in Vietnam to address the problem. For example, the audiology participants in our summer training program have established a collaboration coalition to improve communication between schools, audiology clinics, and hospitals in Vietnam so they can provide better care for their families. We'll continue to work with our partners in Vietnam and other developing countries to help lay the foundation of support that children with hearing loss need to reach their full potential. One of our main priorities is to secure funding to increase staffing so that we can explore and develop new opportunities while continuing to carry out the necessary operations of the Global Foundation and conduct our existing programs. With additional resources, we would expand our Vietnam Deaf Education Program to other geographical areas of the country and establish regional audiology centers at the participating schools to serve families living outside of the cities. We'd also apply resources to expand our model to other developing countries that have requested our support. More research and advocacy are needed to engage governments in helping children with hearing loss access appropriate hearing technology and early identification and intervention. We'd like to implement a newborn hearing screening pilot to quantify the number of babies with hearing loss born in Vietnam each year. We'd also like to pursue additional research that quantifies the impact of our model and multifaceted approach on auditory and language outcomes in children with hearing loss. This would be beneficial in presenting the case for government attention to the issue of pediatric hearing loss.